So how do you know if you're cancer-free? Most cancers have a tumor present, so we can get rid of the tumor, but are you cancer-free? The definition of cancer-free means your circulating tumor cells are 0. But remember, cancer is a chronic illness, and it requires regular office visits, regular checkups, regular blood testing to make sure that you have a cancer-free environment and that cancer is not able to grow in the body. So we do a complete workup on the patient with an elaborate blood workup, checking your kidneys, your liver, thyroid function, inflammatory testing, blood sugar testing, vitamin D testing. We will also check all the nutritional biochemistry that your body needs. One nutritional deficiency can create an imbalance in the body. Then we make sure that the patient has been purified. We can actually assess the toxicity of the body, whether it's toxins that are found in our water, food, and air supply, or they may be heavy metals that permeate in our air and food and water supply. So we got to make sure that you don't have any impeding factors that are creating a cancer environment. Then we do the bioenergetic testing that shows the acupuncture points to see where the imbalance is and where the healing blocks on the body. So you can see that this is a very elaborate process. But who wants to be in remission? There's tumor-free, cancer-free. You want to be cancer-free.